I'm Dr. Manan and I'm the administrator and the director of Chaudhary Hospital. We're a 26-year-old institution. Must have performed around 30,000 surgeries till now, the last 26 years.
Okay.
And
what kind of surgeries do we perform here?
We basically do laparoscopic cholecystectomies, all kinds. The ones which are very complicated, all kinds of surgery related to the uterus, like hysterectomies, myomectomies, then hernias, very complicated hernias. And now I have started since last 6 years the department of proctology, in which we are doing laser proctology.
Okay, so what is laser proctology?
Laser is an energy source. It basically burns the hemorrhoids or fistula or fissure in itself. So there's no need of any external suturing, and it's basically painless. And the special techniques we use, they make these, the patient can return to work the next day, and he has very minor pain or small burning, that's it. They basically have to come to me after surgery once or twice, that's it.
So tell us a little bit more about this technology. How did you come to know about it? Where is it being used?
The lasers are used in many fields like ophthalmology, for the eye surgeries. Now they're being used for venous surgery in the legs and proctology. These are German lasers. They were invented in Germany, and what they do is they, in like hemorrhoids, for layman, they burn the vessels. So the vessels feeding the hemorrhoid, that is the pile mass, they get reduced. So if the patient has a big piles which is coming out, they get reduced and they stop bleeding. And in fistulas, what we used to do, we used to take the whole fistula out. Now what we do is, laser is, we put the laser fiber in the fistula. It burns the fistula as it is. So there is no external hole. This small hole through which the fiber goes inside, that's it. And we have a good success rate in fistula surgery. All over the world, the success rate is around 70%. We have a fistula surgery success rate of 98%.
98%. What happens in the other 2% cases?
Sometimes they are complicated, we may miss something, and sometimes the patient does not come for the follow-up.
So tell us a little bit more about what kind of different lasers are there that you are using to treat these patients, and what kind of different problems do these different lasers treat?
We use a diode laser. Okay, we have multiple wavelengths. The most common wavelength commonly used wavelength used is 1470 nanometer. We have three kinds of fibers, which one is a cutting fiber, one is a conical fiber which is used in piles, and one is a flag fiber or a coronal fiber which is used in fistula surgery. We have to take care when we are doing a surgery. This is basically a high-end energy device. We have to take care the patient does not get a burn. That is the whole sense of training, and you have treated there's a very thin line in overdoing it and underdoing it. If you're underdoing it, the patient will have a recurrence. If you're overdoing it, then he may get burns. So that is the whole training, that is the whole experience.
What kind of a training regime do you have?
I've worked in Germany for 6 months. I've been trained by the best. I've worked in Bombay for 1 year. So after all this training for 2-3 years, then I came into private practice. So my whole 1 year, proper 1 year was training with lasers and staplers in proctology. That's it. No other training was there in 1 year. And 1 year I was working like 18-20 hours every day. Just imagine 18-20 hours for 365 days. That's the kind of training you need. And after 6 years working here, again you keep learning every day with every complication, every patient. You keep learning every day. So this is the output of 7 to 8 years of training and experience and everything.
But there's still a new day, right?
Oh yes. We keep seeing new patients, we see new things, we see new problems every day. That's why it's called medical practice. You're never an expert actually.
Great. So thank you for your time today.